A closer look at a plan to overhaul the nation's mental health treatment laws. And the architect of this plan is a Pittsburgh legislator.
Our Shannon Perrine is here now to break down what he says needs to change right away, not only to prevent national tragedies, but to prevent suicide. September, Suicide Prevention Month. This is all very applicable.
Absolutely. It's a big topic. It impacts all of us. And our state has done some things to fight the growing suicide rate, including requiring schools to train staff to spot kids at risk and to help them. But some really old federal laws are still on the books regarding mental illness. And some believe changing the law could stop the next Jared Lochner, Adam Lanza, or Richard Baumhammers. Or it may even stop someone you love from killing themselves. George Sedini, LA Fitness. John Schick, Western Psychiatric Hospital. These men were reportedly in mental health crisis when they killed others. But
my husband had called him twice that day, and there was no answer.
This young man?
He called again, and there was no answer.
Chuck Mahoney?
The police from Smith Township came to my door. It was about 9 o'clock at night.
A student at Allegheny College?
They said there'd been an incident in Meadville. And they said, your son is dead.
Killed himself. His fraternity brothers did what they could.
He was still warm. They tried to revive him, but he was already gone.
Chuck's parents were not allowed to know that he was suicidal. Step one in Congressman Tim Murphy's H.R. 2646. Keep family members of patients with serious mental illness informed when they are in crisis.
We allow the family member to know under very select circumstances you'd be able to be advised who's the doctor, what's the diagnosis, what's the treatment plan, the time and place of the next appointment, and what medications are they on.
Step two, make sure there are enough mental health providers, psychiatrists, counselors, social workers. Step three, build more treatment facilities for patients in crisis. In 1950, we had 500,000 psych beds. There are 40,000 now. Some patients wait 30 days for a bed in a psych ward, 30 days of danger to themselves and others. Step four, change a couple of silly Medicaid rules. One that says they won't pay for you to see more than one doctor a day.
But if a parent brings a teenager in to see the doctor and the doctor recognizes this person's having a serious problem, they're not allowed to see a psychiatrist that day. We changed that rule.
And another rule that says they won't pay for your hospital stay if the facility has more than 16 beds.
It's an absurd concept. We're basing treatment on the number of beds you have. Can you imagine if we said, here's how we're going to get rid of cancer? We're going to tear down our cancer treatment centers.
If Debbie Mahoney's son had a terminal heart condition, she would have known about it and she would have done something about it. A few requests that you remember her son did have a dangerous illness, and for Congress to try to make sure your son or daughter or parent doesn't die from it too.
That he's not forgotten and that he didn't die for nothing. That let's learn from it. Let's look at the case, look at the mistakes that were made, and let's learn from it. It kills, and something needs to be done.
It does impact so many of us. Now, Representative Murphy's bill also puts the mental health research dollars into what he says is the most promising science as well. He is a working psychologist by trade. He sees patients. And it also provides for more training for police officers about how to react to people in